And we will get started. Okay. So, oops, wrong one. Before I start with the coding, so that you guys can get your SAS fired up, I do want you guys to take a look at the review aspects. So by now you should all be really, really comfortable with creating frequencies, running frequencies of your code, things like that. We'll do that in a minute. So you should also be very familiar with what a data dictionary is, because that is coming up. It's not here yet. It's the last assignment that you have, but I want that in your mind. Because the last thing I want you guys to think about is making tables, which is actually going to be one of the major deliverables of your final projects. So after we start doing tables, we'll start doing visualizations. But when we're running proc frequencies, when we're looking at the counts of our variables or the means, right, the distributions of our information, the whole goal of that is to share that, right? We want to present that information to the world, to our whatever our target audience is. In our case, we're going to pretend that it is a hospital stakeholder, or maybe your manager, or some kind of decision maker in healthcare delivery. Okay, so whenever you are presenting anything, I want you to have two things in mind from the get-go. One is your audience. Who are you presenting to? What's the value? And two is remember the continuum that we talk about. So can you guys can all see my screen, right? Yes, okay. This continuum, remember the data, which you guys know what it is, right? The cells, the zeros, the ones, the information, which is the counts, the frequencies, the knowledge that you got from that information, and then remembering that eventually, we're not there yet, but eventually you're going to turn that into action of some kind. You're going to turn that into a decision. You're going to turn that into a recommendation. You're going to turn that into a, hey, we should buy this and not that. We should invest here and not there. We should put more staff in this service line and not that one this year. Does that make sense? So this is what you're doing with all this information, because right now we've been running these great tables. We've been doing all this really cool stuff. It's like, what's the point? So just as in our coding, right? The first thing you do is proc content. So look at what you have. Then you start descriptive modeling or descriptive coding is to look at the information. Well, what I've done is I've created I've actually stolen table shells from different publications so that you guys can see what happens from each result. So the first one is when we just do frequencies, right? So if you can see here, this is from this paper here. So and it's a good paper because it shows a linear regression analysis. So the outcome is continuous, meaning not yes, no. And if you start looking at this, you can start to see, and I call it table 0 because typically we don't present this as the first. We're usually presenting what I'll show you next. But this is just a descriptive table of the sample that they had. So they're just counting for you. They're telling, we had this many women and this many men. We had this many people living alone and this many people living with others. They represented this percent of the total men and women, this percent of the total men and women. Okay? So can somebody please, that's information. Can somebody please give me this bridge and tell me something about this table, about this descriptive table? I need 2 volunteers to give me one about each variable. So tell me something about the value that you read. This should look very familiar from the pre-semester example. If you remember the little evaluation, the assessment I had you do. Any takers? Okay, do you guys understand what I'm looking for? I just want to see, okay, 64% were women, so there were more women than men in this study, in this sample. So instead of just giving information, I'm giving knowledge, right? I'm saying, and it's not major, it's simple. There were more women than men. So the sample was heavily skewed towards women. Okay, any other takers? Okay, I'm gonna start naming names, here we go.
I can go.
Oh, fine.
Sorry. I mean, there were more people that lived alone than living with others.
Okay. This may seem simple, just wait. Okay, keep going. One more person on this one. Cameron, pick a person. Ha! It's me, it's the background. It's making me mean. I don't know what's happening.
Irene.
Okay, so for drinking alcohol, more, let's see here, 65% about said that they didn't versus about 35% said that they did drink alcohol. So more
Okay.
people said no.
Okay, now we're gonna make a leap in terms of lifestyle decisions. Would you say this is a healthier or less healthy cohort based on alcohol and any other lifestyle decisions that you have available to you? That means you have to look at the whole table. Anybody willing to take that? And the answers are yes, no, moderate.
I'd say it's, sorry, my mic was, freaking out, but I'd say like it's moderate because looking at ever smoker, there's a higher percentage of 53% that do smoke. So
Very good. So what is that telling you?
That they're healthy-ish, but not really because they,
So there's some risk. That's right.
There's some risk, yeah.
There's a very low drinking alcohol reported, a very low proportion. The smoking is pretty high still, right? And then if we look at educational attainment, that's I'm guessing that's years. They should have put the value, by the way. So no table is perfect. That's the other thing I want you to learn. So and that's 12 years, which means that they all graduated from high school. So it's a moderate educational attainment, and it's an older sample too. Okay. So this is where you start gaining knowledge, so that you can start thinking more and more about the impact of this knowledge. Does that make sense? So when you're reading this type of information, you need to spend time with it and not just report numbers. You wanna think about how do these numbers work together. Now I know what are risk factors, what are behaviors, what are demographics. So you realize you know more than you think, and then you start to see, how can I get knowledge from this? So this is information. You now are the professional. You are the expert. You can derive knowledge. All right, so once we have a description, we begin to compare, right? And so remember, what is this? Anybody want to, now this is, I'm just asking, you don't have to know this. What would the SAS, what would this be in the proc freq? This was the next thing we learned in the proc frequencies. So first we had the descriptive tables, the frequencies, and then we did the what? The crosstabs, right? The crosstab, the comparisons. So this is a crosstab. This is called a crosstab. So you'll notice this is the variable. These are the values, right? So variable values. And you can see that there are elements of the frequency table, right? And this should have a big N. So this is my table, and I just found a mistake. So this should have had a big N here. Okay, so like I said, no table is perfect, because I'm not telling you what this is. Anytime you have a table or even a process map, which we'll talk about later, think of it as a map, a guide. And if you don't give a key to your reader, they can't take anything from it. They're not going to know, right? So from here, hopefully you can see that this column is telling you this is the number of English proficient people split up, and this is the non-English proficient, because 246 plus 49 should equal 295, right? So the other thing about reading this is that typically you should read this as a column percent and this as a row percent. I actually happen to do this by column percent it's a unique element of the paper, which is why I reported it. Because typically we read it across. So it would, the two percentages would equal 100. So 246 divided by 295 and 49 divided by 295. But I actually wanted to know the proportion of English proficient total for each age group. Does that make sense?
Dr. Shafino,
Yes.
this might be a little premature, but are you going to go over the discussion post since it's similar to the table 0 at all?
I can if you have questions about it. Yes, absolutely.
Okay. Well, yeah.
Talking about just reporting your table 0?
Yeah, like, are we supposed to find that ourselves? Or?
Yeah, I
Okay.
thought everybody might be a little bit worried about that. Yeah, this is, remember at this, we'll get to that, but no, keep that in your pocket because we're definitely talking about that. That's why this is here. And actually, let's do that now if you'd like. So at this point, all of you should have a data set and you should have an outcome and you should have variables. Okay? How many of you can answer yes to this? Just do a little hand or a finger for your questions.
I was having a trouble opening the zip file.
Zip file?
Yeah, so when I go to my data set, the survey, there's a text that I should follow that helps me how to import the SAS data into SAS, and I'm not able to open a zip file.
Well, you have to unzip it before you try to import it.
Yeah, I tried that and it still didn't open.
Okay, well, we can talk after. That's just, I mean, zip files are typical for Word documents for anything. So that's more of a Google, the type of, you might not have the right zip opener and you might not even have a zip opener on your computer.
Oh, okay.
So that's usually what you Google, but you can stay after and we can look at it.
Okay, sounds good. Thank you.
But how about everybody else? Does everybody else understand that by now you should have a data set that you're pulling that you can make a table with? Anybody not have a data set? Can I see a little row of, like, let's say, speak up if you do not have a data set. I see a lot of connecting to audio. Are you guys okay hearing me? Is everybody able to hear me?
Yes.
Okay.
Yeah, I hear you. Okay.
Okay. Does anybody not have a data set? And I'm sorry, please, you can chat it even if you prefer. But does anybody not, even if it's not open? So like, Judith, don't worry, we'll get it open. That's not a problem. But does anybody not have a data set to work with and does not have an idea of what their outcome variable is and does not have idea of some of the independent variables that they're interested in? And this is totally okay if you don't feel like, you're not in trouble. There's nothing wrong with that. Totally fine. Because my goal is to get you there. That's kind of what I want to do. I'm not hearing any no's. Okay, that's fine. You can tell me after if you feel more comfortable. But so at this point, you should all be able to make a table 0. Is there anybody that doesn't know how they would make a table 0? Cameron.
So if our data isn't working with like people, individuals, like
who's talking right now?
Kira.
Oh, sorry, there you are. Sorry. Okay, go ahead.
Working with hospitals instead of like people, like individuals. I'm not really sure what kind of characteristics you would want us to pull out for the table.
Well, what did the literature tell you? What did the tables in the literature regarding hospitals tell you? What variables did they use?
They had like a ton of data and just information, but not all of it, I think, was relative or related to what I was looking at, because I'm looking at like hospital spending on medical tech. So I'm not sure if I should use every single variable that they include or just pick certain ones that I think would be relevant.
So when you did, and this is one of the issues with the literature review, when you guys look at the literature, you're supposed to see that there's variables that are used often, right? Yes or no?
Yeah.
Yeah, those are the ones that are important, right? So for example, when you're doing organizational level analysis, we talked about this because they're not individuals, we're looking at structural factors. So ownership, who owns it? How big is it? Size, right? So we do that for people, we say sex, age, race, ethnicity. Well, for hospitals, those characteristics, demographics are system membership, ownership. They're usually going to be acute care hospitals. You want, because they're comparable, and size and ownership. Those are kind of the three main ones. And then, but then there's going to be things that are unique for your hospital or for your literature, for your research questions. So that's what you learn and glean from the literature review, right?
Yeah. Gotcha.
So for example, what would you use for yours? Since we're with Kira, what would Kira's table 0 look like?
I'm having trouble pulling up the data right now, but I would guess like what you were saying, hospital size, if it's a nonprofit.
Perfect.
Just
And you would put all the values, right? So here where it says gender, can you guys see the table right here? Table 0?
Yeah.
Okay, so here, you know where it says gender? Kira would put bed size, because how we measure the size of a hospital, which is the amount of resources that they have available, is by the size, the number of beds, right? So she would put bed size, and then she would put, and actually it's perfect segue because we're going to learn how to recode. But if she was using the American Hospital Association data, she would have 8 categories, which is going to look really crazy, but she would put 6 to 24, 25 to 49. Does that make sense, Kira? Are you with me there?
yeah.
And then you would just literally give me the counts of each one, right?
Yep.
And then the proportion. And her outcome, what's your outcome variable? Like, how is it operationalized?
Hospital associated infections.
So yes, no, percent, what is it?
I guess I need to figure that out.
Yes, you do, ma'am. So whatever it is, so let's say it's yes, no. She would put it in this table and she would say hospital, because in table 0, everything goes in there, including your outcome, because it's just a snapshot. Does that make sense?
Yeah.
So you could put it at the top, at the bottom. I don't care where you put it, but Kira would put hospital associated infections, yes, no. And she would put, here's how many yeses I got, here's how many no's, without any comparison, just raw. This is a raw table, right? Does that make sense? Can I get nods or little thumbs?
Yes.
Awesome. Thanks, guys. All right, somebody else that's having trouble, let's talk through your table, because this is exactly what I want to do so you guys feel comfortable. Because I can assume that you guys can understand things or can extrapolate the information because it's like the template, but that's me because I've had years of experience with this. But if you guys don't tell me, then I don't know to what extent you need the modeling, right? So this helps me help you more. Can somebody else go through their table if they're willing?
I'm just confused on mine because my outcome is different and it's not very clear in the data set, since it's like I'm trying to identify characteristics of hospitals with like community partnerships.
Okay.
And there's not like anything that is clear that says like partnerships or like engagement things.
So what you're going to have to do is you're going to create a proxy. You're going to have to find a variable that is a proxy. Does everybody understand what a proxy is? It's like a stand-in for that outcome. So you'll say, okay, well, this is kind of like that. So I'm going to test this because in the evidence, this looks like I can use it to test this question. And my assumption is that you found that. But if you haven't found that, then you need to find that. Does that make sense? And it can be a combination of several variables. So for, like if it's 3 different processes, right? So let's say the hospital offers community outreach services, older adult education, and something else. So then what Tamron can do is she would say, if the hospital says yes to all these 3 things, then we'll say they have partnerships. If they say no to any of these, then we'll say that if they say no to any of these, then they don't have partnerships or something like that. Or she can do a midpoint and she can say, if they say yes to at least 1, then they have some partnerships, but not a lot. So she could have a strong, medium, and none. But that does make your outcome harder. So you want to keep it dichotomous or continuous? You guys understand dichotomous and continuous? Dichotomous is just 2 levels, or binary, 2 levels. And then continuous is like weight or blood pressure. So it could be many numbers. Does that make sense? Yes? If not, say no, then I can help give you another way to explain it. Okay. And what about Justin? What is your outcome? I'm going to go around. I'm going to just grab you guys and ask you to tell me what your outcome is operationalized, because this is a spot check.
Well, my outcome, so basically my question is, how can MAT centers impact the essential cost of traditional treatments for SUD related services? And so I guess the outcome would be the cost and also the general variables that I have to account for that kind of identifies the health of the patient after the treatment. So
just focus on one though for this analysis, okay? Do you have the data in hand though?
Well, I haven't, not specifically, but I was gonna, but basically what happens is at a county level, they have kind of behavioral health data. So I was gonna go look to that.
Okay. Yeah, because that's, I mean, one of the things when we all met for the data is that you guys were to get the data in hand. So if you don't have the data in hand, meet with me. But I think just the one outcome is going to be sufficient, Justin. And then you can look at all the characteristics that are available to look at the associations. Okay?
Okay, I'll try to skim it down, just focus on one thing.
Why don't you email me and tell me exactly what data you have so that we have that nailed down for you?
Okay, I'll send you an email.
All right, what about Thelma? Do you have an outcome? Thelma? Okay. Luke?
Yes. So I'm looking at UDS data, Uniform Data System data. So that's your data on every single FQHC and FQHC look-alike in the country.
Oh, wow. That's
and yeah, it's something like 1,400 health centers. And I want to compare the proportion of patients seen at the health centers who have Medicaid as their primary payer and compare that in expansion states versus non-expansion states.
Okay, so what I would do there is make sure that you just have a dummy variable for the expansion and non-expansion states, just to keep
That's exactly what I need to do.
very good.
That's like the one thing that I need to incorporate into the existing UDS data set.
Very good. And we can do that. I can help you with that if you need it. All
Cool.
right.
I probably will. Thank you.
What's your outcome though? Tell me how you're measuring it.
So the outcome would be like the percentage of patients who have Medicaid as their primary payer.
Excellent.
So that would be the dependent variable, and the independent variable would be whether or not the state had expanded their Medicaid program during the reporting year, which would be last year, 2019.
So this is a proportion, right? So this is an ordinal variable that can be a ratio, because he can say half of the patients, 50%, 20%, 1/4, right?
Mhm.
It's not quite going to be a logit model, and it's not a linear model, but you're going to treat it like it's a continuous variable, so you can do a linear model, because if you're going to actually do this for your final project, then it would be a negative binomial. And so hopefully the logit and linear regressions will be reminiscent for you guys. Okay? But that's a little further advanced, so don't worry about inferential statistics. Natalie, do you have an outcome?
Yeah, and I also have a question that I was trying to chime in before, but so my question is, does having health insurance associated with higher influenza immunization rates?
Nice.
But I have a question. So I'm using the Burfis data, but I only am using California within that. So would my table 0 be just on California participants?
Yeah,
Or do I
you would
have to
just
do
say
like
sample characteristics of California Burfis respondents
okay.
and equals whatever. Yeah. And you would also add unweighted, but that's simple. But that's exactly right. That's exactly right.
Wait, that's simple. Not simple for me. What do you mean?
Oh, don't forget the unweighted part. But yeah, no, you're exactly right, what you just said.
Okay, thanks.
And so that's where, like, in the design activity that you had, the research design, that's one of the things that you have to, it's not necessarily a limitation. You just have to be cognizant, and this is for everybody, when you write things up, remember at the very beginning of the semester, and I've been hopefully pounding this stick, is the underlying assumptions, right? So Natalie's going to make assumptions and relationships for California only, applicable to California only, right? She can have some wonderful exploratory conclusions for the rest of the United States, for the populations that she studies, and for people with and without insurance, because everybody is affected by insurance. But she was only able to look at California. So she can say, now I can look at all the other states in the US and see if they also behave the same. But she's cognizant that the reliability and validity is generalizable only to California. So that's, a lot of you had questions about secondary data. And if we answered the questions the same way as we would for primary data, that's the way you would do it. Does that kind of answer any of those questions, or getting some confused faces and some nodding? So I'm like hopeful, semi-hopeful. Okay. And then Natalie, how are you measuring your outcome? Is it yes, no? Is it percent of?
Yeah, I'm measuring the association between it. So I have not gotten that far. Biostats and all these classes are like not my ideal of
It's okay.
I'm really good at. So I still need to really spend time figuring that out.
Well, this is actually how your variable is coded. So you're saying if they have insurance, yes, no, then immunization, yes, no?
Yeah.
Okay, then your outcome is binary. It's dichotomous. So you're going to do everything you do is essentially categorical. Write that down. You'll need it in a minute. Okay.
Just did. Thank you.
All right. Anybody else want to share their outcome? Anybody else? Any other brave souls? Okay. So,
Share or not?
Yeah.
Please.
A question. Go ahead, Twee.
Oh, sorry. I'm so sorry. The person.
No, go ahead, Twee.
Oh, okay.
Yeah, we can get the question. No worries.
Alrighty. So my outcome, I had like changed my research question just to get it to clarify a little bit more. But if can integrating nutritional items into a pediatric wellness assessment lower childhood obesity in urban communities? And I'm using BMI, and it's in percentage. So I like, just based on the conversations that you're having with the other students, I think that's what I'm looking for in the, which one is this? The NSCH, the National Survey of Children's Health.
Oh, very good. So you're going to be in the same boat as Luke.
Okay.
You'll have it's going to be ordinal, but you're going to treat it like a continuous variable just for ease of analysis for this example. Okay.
Thank you.
All right. Very good. And then it'll be the nutritional inclusion. It's categorical, right? Yes, no. Or the nutritional screener. Okay. All right. So you guys I think you guys don't give yourself enough credit. So it's okay to make mistakes. You guys basically are going to do fine in this class. I hope you understand that I'm not here to evaluate, give you bad grades. I'm here to get you guys to take risks. So go crazy, get out there and just get real dirty with your data. I know that sounds weird, but that's really, who was it? Was it you, Brandy, that I talked to that had a lot of questions and then she just dug in? It was you, wasn't it? And she realized that playing with the data is really what's going to get you the answers. So don't be afraid of your data where you need to be prepared to make that first pass and then it's going to be perfect. Get in there and make mistakes and then realize, kind of come to an understanding as you're in it. Because I think that's going to give you a lot more answers than you think.
Can I ask a quick question?
Of course.
So how many data sets do we ideally need to have? If we just have one good one? Okay.
One. I want you, do not get more than one, please.
Okay, perfect.
Merge, unless I teach you on the side. Please only have one. Tamarin, I may need to merge, but I'll merge it for you. Because you need to tell me what variables you want if you're using the hospital data set. But you need to let me know ASAP, young lady. So we need to set something up with me ASAP. But yeah, no, I don't want you guys merging. Just one data set. One data set, one little question. Because this isn't about this is not the Nobel Prize winning work. That's for your final projects. This is just practice.
Okay, and then because I have a full text that I was able to access, and they used 3 different surveys that I was looking at and kind of did their own analysis of the data, but there's also like a raw data set, just like you have on the screen with the N and the percent. So is that good enough, or do I need to actually access the surveys that they used? If that makes sense.
This is not a data set. This is a table. So this is remember we talked about data, information, knowledge, action. This is information. This is not data.
So it's information they extracted from the data sets.
Yes, exactly.
Okay.
So you need the data.
What happens if I need the data, but you have to pay for it? Is there a way around that?
No. I mean, that's why that's what the challenge is. If you're still struggling with that, let's definitely talk like ASAP, like right after class, and we'll get you a data set, because that don't pay for anything. Not right now.
Okay.
For your final, if there's something you really, really want, we can try to see about getting some money, but really, yeah, there's so much great data out there for this kind of practice. There's no need to pay. Please, nobody pay for anything, for sure.
I have an issue similar to Cynthia's. The data set that I would like to use, I thought there was a way to access it without requesting for access, but it's saying that you need a request for access, and that if you're a student, your professor needs to request for access. So I don't know if that process is lengthy, and it'd be better.
It's good for your final project. And I know I didn't say this a lot. I did mention this briefly to you guys, that do not do that for this project.
Okay.
But we can do that for your final project. So don't lose hope, but definitely not for right now. You don't want to do that, because we never know. It could be super fast or it could be super slow. But if you really like that data set and it's something that you want to do for your final project, we can get that for you.
Okay.
Okay, sorry.
Professor, when you say final project, do you mean our like culminating projects for the
Yes.
entire program, or just
Yes.
for your class?
Yes. No, sorry. Yes, for your MPH. For this project, I really just want you guys to practice exactly what we've been doing, but on independently. So the whole purpose is for you guys, because what's going to happen to you, and I swear you probably are like, she's insane. It's going to happen. I swear to you, you're going to get a data set in Excel and it's going to be thrown at you and they're going to be like, please make something of this. It's worth, 300,000 to our program. Can you tell us, can you make some tables? Can you make a presentation for us? And it's going to be literally just an Excel file. So I want you guys to be like Excel processing information, or sorry, not even Excel, CSV, anything, but information processing machines.
And I have a follow-up question. Speaking just to this class, what are the expected deliverables from each of our individual projects for this class? What do we need? Like, do we need to write a paper? Do we just need descriptive tables?
Every assignment that you've done has been a deliverable. And then you do have your project, which we'll talk about, but I have to get through this to get there. So I will get there.
Okay, thank you.
For now, as you can see, you've slowly been building up to it, okay?
Mm-hmm.
And you guys know how to do a descriptive table. You guys know how to code a crosstab, right? Yes?
Yes.
Guess what's going to be next week's discussion? The crosstab, the comparison. Okay? And then we may or may not get to inferential, because I want to do visualization for sure. You may or may not get to inferential. You'll definitely get to it in your capstone for your MPH. But I wanted to give you guys examples of every single one. And that's what's here, okay? So when you want to, you look at this and you can get an idea of that. So does that answer your questions for this section? For what is a table and what is a descriptive table? Right here, a frequency table. So when you hear a professor say descriptive table, frequency table, you can confirm and say, do you want any comparisons? No? Okay, I know it's a table 0. Then I'll do, okay, do you want a frequency table with comparisons? Okay, then I'll do a chi-square or a t-test if the outcome is continuous, right? So you know that the outcome is categorical and binary because we have a chi-square value, right? This is how you can infer things. Does that make sense? So now we're bringing in your stats course, okay, guys? So now you're bringing in your stats and epi training, because I want to be able to stop and do every single aspect of that, but we're limited with time. So I actually did make you guys a little primer that I posted for you in HSR resources. So with all the code on how to do this. So I'll do that, but I really need to show you guys the SAS code on, because we're already a little bit short on time, as usual, sorry. So I can show you how to recode a variable, because that's something you really need for your tables if you want them to look neat and clean, right? So any questions about this, about these two tables? Just the two basic tables that you already know how to code perfectly, right? Everybody know, because you guys did it everybody did it right, by the way. From my first pass at your exam, everybody did a crosstab, everybody did a frequency. So FYI, okay. So let me run over to the coding. So the skill that we're gonna learn today is making a new variable, okay? So when we recode a variable, let's say we did our proc contents, right? That's the first thing we always do. This is all the same data, I'm just adding to it. We did our proc contents and we realized, they're all character variables. And to do chi-square, to do any inferential or any statistics, we have to have numeric variables. Does everybody understand what I'm talking about when I say character numeric? Let me review it. So you have to have information here, the type, it has to be numeric. Oops, you see here? Just do a little wave or a sound or a honk or something. Okay, I saw a little wave. Okay. I don't know how you would honk. I don't know why I said that. So, but when we want to do frequency tables, it's fine if it's character, right? It doesn't matter. But if we start comparing tables and we start running statistics, we need to have numeric data. And why do we care about statistics? Why do we care about chi-square or t-test? Can anybody remember that? Or does anybody want to venture a guess for that? Or you guys just want me to tell you?
It helps us understand relationships.
Yes, yes. It doesn't tell you the direction or the strength, but it tells you that there's a difference. So preliminary comparison statistics like chi-square and t-test tells you that there's a significant difference versus just two numbers being different, right? So if you look at a number and it's 40% and 30%, you're like, well, that's different, but does that difference matter? And that's where you start to understand which factors, which variables need to go into your regression model. So this is why descriptive statistics are so critical to pick. When you hear about model selection, who remembers the word model selection? Who's heard it kind of briefly, vaguely in your memory? Like these poor people trapped behind me, okay? So it's really important. So we wanna make numeric variables. So that's the first one. I am teaching you the world's laziest way. So if you ask anybody who taught you how to do this, it's not me. Don't tell anybody I taught you this. This is the laziest way ever, but we ain't got time for this, so we got to do it. So to turn your character variables into numeric, first of all, you guys remember that map 1 is the character of Joint Commission accreditation, right? So you can only make new variables in a data step. Notice it's not proc. I dated this, by the way, so you can see it. Notice it's not a proc step, it's a data step, right? You are actively changing your data set. We're adding a variable to our SAS file, Excel looking file, right? So be careful here. You put the new data set. If you wanted to make a whole new data set, I could rename this something else. Look, same live name, same folder, new, old, meaning I'm making the new data set from the old data set. So baby, mama, you know what I mean? Child, parent, child, okay? Now baby mama, you'll remember that, okay? I know you will. Listen, smarties. Okay, so you must do this. Everybody understand why? Because you're telling SAS, I'm making a new data set, but really I'm changing it. In this case, I'm actually making the same data set. So I'm overwriting my data set. You don't have to do that. You can make a new one. You can call this sassy.ham, set, sassy, AHA, blah, blah, blah. You can call this sassy.shafino, sassy.why me, God, sassy.whatever, sassy.I hate sass. I don't care. Call it whatever you want. Anything. I mean, if you do any bad words, do not share your screen. But that's it. That's the only advice I can give you. Now, the first one I want to show you is making a numeric bar into a, oh, sorry. So, oh, and I spelled making wrong. So this is, we're making a character variable into a numeric variable, okay? So this is the new variable name. I named it JC, like Joint Commission. And all I'm doing is I'm doing the old variable that's a character and I'm multiplying it by 1. Because SAS, for some reason, decides that this is how it becomes a numeric variable. Again, this is not my favorite way to teach you, but it's the fastest. Because it's just not elegant. Let's leave it at that. But it works, okay? Here's how we recode, and actually specifically we collapse. Any questions about changing character into numeric? Somebody summarize it for me. or make a comment about it.
I have a question.
Yes.
I wanted to confirm the data command. So
Yes.
the sassy.aha demo 14, did you made that up, or is that your lib name and your data set name?
Yeah, that's the data set name I imported. That's my original everything, right?
I see.
And
Okay, so you're telling it to talk with that lib name and that data set, and then you put a semicolon set. That doesn't make sense to me, but I guess I just copy it.
well, because I'm overriding my own, but here, let me make it easier. New.
I see.
Dr. S.
And that'll create a new data set
New data set.
named new Dr. S.
Very good.
Got it.
I
Okay,
just
because
don't wanna
that
create a
data is
new
the
data
baby,
set.
sets the parent.
Yes, yes.
What's the difference between
Okay.
creating a new set or overriding your old one?
Is that I have two data sets that are almost identical except for these two new variables.
Okay, are there any disadvantages of overriding?
It just takes up, not really. Unless you mess up or accidentally, yeah, like if you accidentally overwrite a variable. So I already have a copy of this copy, so that's why I'm overwriting it. But if you don't have a copy, then I would make a new one. So why don't you guys all just make a new one? So I'll make a new one. So here's this. Now watch this, right? So let's look at the differences. So let's do this. And you can see ah! And all I want you to do is look at variables. Well, you can look at everything. Oh, but you know what? I had already overwritten it. Damn it. That's going to ruin that. So, well, typically what you'll see is you'll see two less. So this is AHA 174, which really should be 172. And then this one you'll see 174. But I had already overwritten it previously, so that's why you can't see the difference. But if you guys do a new data set and do this, you'll see that there's a difference with two. Does that make sense?
Why is there a difference with two?
Because you're adding two new variables. You're creating two brand.
Oh, I see.
One brand new variable, and here's another brand new variable. Does that make sense?
Yeah.
I already overwritten mine, so I kind of ruined all the fun because I practiced because I wanted to make sure that I looked all fancy and put together. And so I ruined the fun for you guys. So you guys do this and you can see that. So somebody, when you're done, run your contents and get through all of this and raise your hand when you're done. And ask questions, but make sure you don't cut and paste mine. Type it in.
We do need to, we can't change the SASE though, right? We have to put our lib
Oh no,
name.
use your live name and yeah, this is yours. Remember, always remember that what I'm showing you is my code. So always remember that the data, anything that's unique, we all share the same variables because we have the same data set, but we share different data set and live names, right? We all have our own unique ones. So for example, Twee, what's your live name?
Mine, it's T Doe.
Okay, and what's Brandy? What's your data set name?
I was using the week 4 data set, so I just called it that.
So if I were to do tdoe.week4 data set, it wouldn't work because I'm using Twee's live name and Brandy's data set name, and I doubt they're the same. Because Twee, I would hope, has a different data set name. Hopefully. See?
So
Work.
I have a little different question.
Mhm.
When you're creating or overwriting your data set, you need to use the same lib name for both, correct?
Well, yeah, you want it to be in your same folder. Yeah.
So if you're going to name a new data set, then you want to put the same lib name as the parent, but a different data
Yes.
set name.
Yes.
Okay.
And that's, I mean, we can get into different lib names because that's advanced, but yes, because you want everything in the same place. Remember, the lib name is a place, but the unique thing is the data set, right? Just like a file, you have all kinds of files, a folder, but you have all kinds of files in that folder, but they're all uniquely named. I could have even done AHA demo 14.1 to show it's a copy, right? Like we do with the, when Microsoft does a copy, it does a little like copy with a little -1 or something. And I haven't explained this one yet, so you can type this in, but it might not make sense until I explain it to you.
What is the JC
Oh,
mean?
Joint Commission, because MAP 1 is Joint Commission accreditation, right? So I just renamed the variable, so it made sense to me too. This is the new var name, and this is the old var name times 1. Does that make sense? And don't forget, the stuff is all in your SAS code snippet, see? Right here. It's in here as well. So this tells you right here, new data set, old data set. Most simple renaming, new var name, old var name. So I do this, the new and old in here, because if I put it in SAS, it just acts crazy for me. So it's better I don't. But it's in your little snippets file. Okay. I'm gonna, I want you guys to keep doing this. And while you're doing it, I'm gonna mention why we collapse categories, okay? Does everybody feel okay with me doing that? Stop me if not. And all I'm doing is here. So I'm just gonna remind us about bed sizes. We had 8 categories for bed size, right? So again, a biostats reminder of degrees of freedom. Hopefully that rings a bell. So when we have too many values, too many categories, that eats up our degrees of freedom, which if we don't have enough sample, that can affect the outcomes of our analyses, right? Is this kind of familiar? And if not, just trust me on this. You don't want a lot of categories in your categorical variables because it impacts your degrees of freedom. Factual statement. Go with that. So 8 categories is a lot. So we typically, when we think about size, right? So Kira, this is going to affect you. Tamron, if I recall, I know you two are going to be affected with your hospital level. You want to think about hospitals size as small, medium, large, right? So we want to collapse this. I picked 3 levels. So I decided by looking at the distribution of each of these buckets with the frequencies, I said, let's collapse these into less than 50 beds, 50 to 199. Okay, so do you guys see how I chose this? And I can show you the math behind it later, but for now, I decided to collapse it into 3 categories, right? Does everybody understand this to this? So you have a variable that's 8 categories and you want to make it into 3 categories. Does everybody understand wanting to do that?
Yes.
You don't have that in your data set, so you have to do it. You have to create a dummy for showing 3 categories of bed size. That's what you do here. This is called a conditional coding. If then. See the if then? So do you notice that the categories are 1, 2, 3, 4, 5, 6, 7, 8? So do you see how?
You understand the categories? I'm just confused by the yes, no. The no, yes. The last one you have?
Don't look at that one yet. Let me explain to you that one separately. That's different. This is a proc format. This is just me showing you the categories. Don't worry about the format statement.
Okay.
This is just us recoding. I'm sorry, I was just using that for reference, but I will explain that to you in a minute. That's a great question too, Kira, but let's not get into that one just yet.
Okay.
That's actually universal coding, and I'll tell you about that in a minute. But don't look, formatting, sorry, universal formatting. Okay, so let's just pretend that's not there. Don't look at it. Don't look at it. Pretend it's not there. I just covered it with my hand like that's gonna help. Okay, so if you notice, I want you guys to look at this. Is everybody here with me? So we're saying if bed size code, the super big one, is a 1 or a 2, then I want you to squish it together and make it equal 0. So that's my small hospitals, right? And the reason I call it 0 is because in statistics, we have reference groups, and usually we do 0 as the lowest risk category or smallest. So out of habit, the smallest is 0. And then when we're doing multiples, the second command is always else. I don't know why SAS just like that. So we do else if, again, the old variable, if it's these categories, 3 or 4, then I want it to equal 1. And if you see 1 is 50 to 199. And then lastly, for the large categories, 5, 6, 7, 8, right? And then here it's, if there's anything missing, go ahead and throw it in there, but make sure it's missing. So it's not like dropped or false or lost somewhere, but that it's coded as a missing. So does everybody understand how that works?
Yeah, so this is recoding your variable, right?
Exactly. All we're doing is we're recoding the exact same information, but into a little bit smaller. So we're just making it a little bit more compact, but we're not losing anything. We're not losing anything. We're just collapsing some stuff into each other.
So is this what you're referring to as the lazy way?
No.
Collapse.
This was a lazy way up here.
Oh, okay.
Of making a character variable into a numeric variable. This automatically makes this numeric because we recoded it. So this makes this numeric.
Okay.
Okay.
So would you run both of those?
Yep. And if you notice, I can see the data and run. Because remember, everything finishes with a run.
Then if they're doing the same thing?
Sorry?
But I'm just curious why we need to run the JC equals map 1 times 1 if the bottom half does that for us.
Oh, that's a different variable. It's 2 different variables. We're making 2 variables.
Oh, I see.
We made map 1 into a numeric variable and renamed it JC. And we made a new variable called beds that's collapsed from bed size code. So we have 2 new variables called JC and beds.
Got it. Thank you.
But you also want to run a check. So you do this. And here's what I do just in case, is I put the old one and the new one side by side. So the old one and the new one side by side. And then you see if it worked. And you notice that they are identical, right? So only this time, this one is character and this is numeric, but it's exactly the same. And this one is character and this is numeric and this is smaller. And if you were to add up 742 and 1447, you would get 2189. If you were to add up, I think it was these 2, 3 and 4. Yeah. 1243 and 1274, you would get 2517, and so on and so forth.
I have a question.
Yes.
So it looks like the 2 new variables you created don't have a name or a label to them.
No, they do not.
Right.
I make a label. That's correct.
But is if we were going to reference those new variables in another command later on, would not having a label name wouldn't impact our ability to
Not at all. Not
reference
at all.
it, correct?
Nope. And in
Okay.
fact, you could even do, I could even do it here. So we could do, you know, if you want to do label right now, you could do label JC joint. Oh, I always forget this. Joint. And what's the other one? Beds. Rows. Bed size.
And that's not a permanent label, right? You're just saying for this output,
Now,
label this variable this.
I don't think it's that. I'm not sure about the permanency. To be honest with you, that's a great question. Yeah, that's better. Looks better. Okay, mine's not as pretty because it's not capitalized, but there you go.
Dr. Schiaffino?
Yes, ma'am.
This is gonna sound really embarrassing, but I
No,
think
don't say that.
I think I forever closed that output table view on my PC SAS program because I have the variables. It's just showing me under the log. It's not showing me the chart. The results. It's not. Maybe if I click on it, the results isn't popping up for me.
Oh, base SAS.
Sorry.
You have base SAS.
Yes. Yes.
Go to view and do view output.
View. Oh. My output's empty.
Yeah, run it again.
Run it. Okay, hold on. Yeah.
Did you run your live name too?
I thought I did. Yeah, I ran my live name.
And then also I would go to results on the left-hand tab. So it's one of those. View output or results.
Maybe open?
Yeah, if you have. But it's either output or results. I can't ever remember. I'll look at yours in just a second. Okay. So how's everybody doing with, but I'll look and just, that's a very small problem. You're good. You're totally fine. Don't worry. How's everybody looking on this stuff? So does everybody think that they can make a new variable or at least start to? And in the snippets, there's lots of other ways. So I put in a couple of other ways that you can do very simply. Like you can just literally rename it, sorry. And if you need to do like a conditional with multiple variables, and I think Tamron, you're gonna have to, then you would do if variable 1 equals 1, like yes, and variable 2 equals 1, then the new variable equals this. But feel free to ask me how to recode a variable and we can put it up here for everybody to see. So that if you guys need help recoding, I'm happy to do that. Okay? But one of the primary things is that you will need to spend time with this. I don't want a ton of independent variables. I'd say 5 at the most. 5 in your outcome. So we're talking about a 6 variable analysis. But I want you guys to be confident with it. That's what's most important to me. Okay? How does everybody feel about tackling that? I am 100% confident that you can do that. So if you aren't feeling confident that you can do that, then how about you just believe me blindly for just this once? And then just go at it and then call me. Does that sound like a fair deal? Because I know I've seen each and every one of your outputs, your work, and nobody's perfect. We all have a lot we can all improve things, but I am confident that each and every one of you can do that. So if I'm telling you that, that means that too bad, you already proved that you have the capacity to do it. Now you just have to spend time with it. So without further ado, we're gonna take a break. And when we get back, I'll try not to go over too much, but I do want to review the assignment 6, which is process mapping quickly, and a little bit of the final project, mainly the rubric, since I'm still not in love with the template I made for you guys. I'll let you look at it, but I'm not married to it. So I don't want you guys to put the bank on it. Deal? Does that sound okay? All right, take 5 minutes, stretch your legs, get some air, get some water, and we'll come back, okay?
Oh, Dr. Shafino, good news. It popped
Yeah.
up. It popped up. So
Good.
thank you.
So glad. And everybody else that had questions, don't let me forget because I want to answer those. I think I got most of them, but if I didn't, let me know because I want to make sure I got them all. Okay. I know Jacob had the final project questions, which I got. And there was another one. Kira, you had one. Well, hopefully you'll remind me if you remembered. All right. See you guys in 5 minutes and then we'll be back. Okay.